For the first several minutes, we would like to focus on what to include in a heart-healthy diet. Then, we will look at what we should be limiting or avoiding to maintain a heart-healthy eating pattern. One of the largest components of a heart-healthy eating pattern is including a variety of fruits and vegetables. Fruits and vegetables contain fiber, the part of plant-based foods that the body does not digest. The fiber in fruits and vegetables can lower bad LDL cholesterol and keep you feeling full longer. Fruits and vegetables are also full of vitamins, minerals, and other antioxidants, which fight against harmful, cell-damaging free radicals in your body. With such a wide variety of nutrient-rich fruits and vegetables, it's easy to fill half your plate with these foods and reap all of their heart-healthy benefits. Choose whole grains and legumes. These are fiber-rich foods important for heart health. Legumes include beans and lentils, which have the added benefit of being an excellent source of plant-based protein. Whole grains are called whole because they include all three layers of a grain, including the fiber-rich outer bran layer, the middle endosperm layer, and the inner germ, which houses important vitamins and minerals. Refined grains such as white bread, cake, pasta, and other baked products made from white flour remove the outer bran layer and the germ. Therefore, most of the grain's heart-healthy fiber, vitamins, and minerals are lost. Some refined grains are enriched, which means the vitamins and minerals are added back into the food after processing. However, the fiber is not added back. To find a whole grain, look for the word whole next to the first ingredient in the ingredient list on the food packaging. For example, whole wheat or whole oats. Like fruits and vegetables, some types of fiber in whole grains and legumes can help lower bad LDL cholesterol in the bloodstream. Fiber is believed to bind to cholesterol in your digestive system and move it out of the body before it's absorbed. Fiber fills you up and keeps you fuller longer, which can prevent overeating and weight gain, which is another risk factor for heart disease. Choose foods that provide heart-healthy fats. Two types of heart-healthy fats are monounsaturated and polyunsaturated fats. Polyunsaturated fats include omega-3 fats. Healthy fats are found in plant oils such as olive oil and canola oil, avocado, nuts and seeds, and fatty fish like salmon, mackerel, herring, lake trout, sardines, and albacore tuna. These fats can reduce your bad LDL cholesterol. Omega-3 fats can also reduce risk of abnormal heartbeats, reduce circulating blood fat called triglycerides, reduce growth of plaque that narrows blood vessels, and lower blood pressure slightly. The American Heart Association recommends eating fish at least 2 times a week. Each serving is 3.5 ounces cooked or about 3/4 a cup of flaked fish. However, if you prefer not to eat fish, excellent plant-based sources of omega-3 fats include flax seeds, chia seeds, hemp seeds, and walnuts. We've talked about what to include in a heart-healthy eating pattern, but we also need to be aware of what to limit or avoid to maintain the healthiest heart. Eat less refined grains and foods with added sugars. These foods have little to no fiber and are easily digested and quickly absorbed. This can cause a rapid spike and fall in blood sugar and insulin levels in your bloodstream, leading to hunger and overeating. Eating more food makes it difficult to maintain a healthy weight, which is known to increase heart disease risk. Foods with added sugars and refined grains include candy, fruit drinks, soft drinks, and many sugar-sweetened beverages, white rice, and any product made from flour that is not whole grain, such as white bread, pasta, cake, muffins, and many cereals. Next, we want to eat less saturated fat. Eating foods with saturated fat raises bad LDL cholesterol in your blood, increasing heart disease risk. Your body does this because the liver produces more cholesterol when you eat a diet high in saturated fat. Saturated fat is found in animal products such as fatty cuts of meat, poultry, pork like bacon and sausage, dairy products like 2% in whole milk, cream and cheese, butter, and fried foods. These foods also contain dietary cholesterol. By cutting down on these foods, you will also be reducing your cholesterol intake. Swap out fattier cuts of meat and processed meats for leaner choices of freshly prepared meat to cut down on your intake of saturated fat. Some examples of lean cuts of beef include eye of round roast or steak, sirloin tip side steak, top round roast and steak, bottom round roast and steak, and top sirloin steak. Choose cuts that are USDA graded choice or select instead of prime, which usually has more saturated fat. Look for meat with the least amount of visible white fat, called marbling. When selecting ground beef, opt for the lowest percentage of fat. Before eating poultry, remove the skin where most of the fat lies. Some plant-based foods also contain saturated fat. These include coconut, cocoa butter, and tropical oils like coconut oil, palm oil, and palm kernel oil. Lastly, be mindful of portion size. The American Heart Association recommends no more than 6 ounces of cooked meat, poultry, or fish per day. To help determine what this would look like, a 3-ounce portion is the same size as a deck of playing cards. Like saturated fat, trans fat can raise your bad LDL cholesterol levels and reduce your good HDL cholesterol, increasing risk of heart disease. Trans fat is found in stick margarine, shortening, and packaged foods made with partially hydrogenated fats and oils. Nutrition facts labels list trans fat as long as there is half a gram per serving or more in the food item. If the food item has less than half a gram per serving, you can find out whether the item has any trans fat by looking at the ingredient list for the words partially hydrogenated. Sodium, or salt, is another nutrient that should be consumed in moderation for a heart-healthy eating pattern. Sodium is added to food for flavor, texture, or preservation. Sodium is added to most packaged or prepared foods, unless labeled sodium or salt-free. Canned foods, pickled foods, sauces, cured fish and meat, cheese, and fast food are examples of foods that have very high amounts of sodium. High sodium intake can cause the body to retain water, resulting in high blood pressure or, for people with heart disease, swelling and difficulty breathing and moving. Control your sodium intake by cooking foods at home and limiting fast food or packaged and canned foods. Add herbs and spices, naturally low in sodium, rather than salt for flavor. Check the nutrition facts label on packaged foods to determine how much you are consuming, paying attention to the serving size. Speak with your doctor and registered dietitian about the amount of sodium right for you, as the amount may vary based on your medical condition. To show you how easy it is to reach your daily sodium limit, 1 teaspoon of salt equals about 2,300 milligrams of sodium, the recommended daily amount for most people, according to the U.S. Dietary Guidelines for Americans. Now, let's practice an easy way to plan a heart-healthy meal. Using the plate planner method, you can build a heart-healthy plate. Half of your plate should include non-starchy vegetables and/or fruit, such as lettuce, tomato, carrots, spinach, broccoli, banana, or apple. A quarter of your plate should be a complex carbohydrate, such as a half cup of brown rice and beans combined, half cup of quinoa, a medium baked potato or other starchy vegetable, such as a half cup of corn. The other quarter of your plate should be a lean protein or plant-based protein like chicken without skin, fish, or tofu. Dairy products can be added, such as 1 cup of milk or 1 cup of yogurt, carefully choosing low-fat or fat-free versions most of the time. Healthy methods of cooking should be utilized, such as baking, steaming, pan grilling, braising, or roasting. If oil is used, choose monounsaturated and polyunsaturated oils, such as olive, canola, corn, or vegetable oil. Limit the use of butter in cooking, which is high in saturated fat. Include 2 to 3 servings of fresh, whole fruit per day, and drink water, seltzer, or unsweetened tea. It's best to avoid juice and sweetened beverages, as these are a source of refined carbohydrates. To help you make the best food choices, read the nutrition facts label. Let's review the most important parts of the label. First, take a look at the serving size. Next, look at the servings per container or package. Many packages that appear to be 1 serving may actually have several servings. Review the sodium, saturated fat, and sugar content. Lower numbers of these nutrients help maintain a heart-healthy eating pattern. When eating outside of the home, consider these tips. Ask for all salad dressings, gravies, and sauces on the side so you can control the amount you use. Ask for foods to be prepared with little or no salt. Instead of starting with soup, which can be very high in sodium, start with a salad with dressing on the side. Choose foods that are baked, pan-grilled, roasted, broiled, or steamed instead of fried or sautéed in butter. Eat half of your meal at the restaurant and take the other half home to use for another meal. Apply the suggestions already provided in this video to make the best choices. Let's do a quick review of heart-healthy eating. Eat more of the following foods: fruits and vegetables, whole grains, healthy fats such as nuts and seeds, avocado and vegetable oils, lean protein such as chicken and turkey without skin, plant-based protein like tofu, beans, and lentils, and fatty fish such as salmon, lake trout, albacore tuna, and sardines. If you don't eat fish, include the other sources of healthy fats and lean protein mentioned. Eat less of the following: sodium or salt, processed meats such as bacon and sausage, refined grains such as white bread, sugar-sweetened beverages such as soda and fruit drinks, and saturated fats such as red meat, butter, and coconut oil. Having trouble planning a meal at home? No problem. Just follow along with these easy recipes and you'll be cooking up delicious, heart-healthy food in no time.